Hi, this is Dr. Rudra Mohan, and today through the Oral Health channel, today we are going to be covering a live video of a palatal biopsy done assisted by a laser. Let's start. So this video is actually directed not towards fear mongering or to spread any sort of fear or anxiety amongst patients about cancer. But the whole and sole purpose of this video is to show how a biopsy is done of the palate with the help of a scalpel and a laser, and just to make sure that the biopsy is done to rule out or at least diagnose what the condition that the patient is presenting with, so that once we have the diagnosis we can go for the correct treatment plan. In the next few frames you will see the live video of the surgery being performed. Please be advised that viewer discretion is advised. It's not for the sensitive audiences, and the sole purpose of this video is to increase awareness amongst patients and masses. So as you can see in the video, we are anesthetizing the area where the palatal lesion is seen. The patient is a BD smoker and explains and complains of a red lesion which actually burns on consuming spicy food and hot food. We have achieved adequate anesthesia in the palate so that we can start using the blade to do a sharp dissection of the tissue of concern. And here we are taking an incisional sample for a biopsy because the lesion is very big. What we are doing is we are taking the diseased tissue, or rather the tissue of concern, and we are extending the margins to normal surrounding tissue. Why these margins are taken is because of the fact that we need some normal tissue for comparison purposes histopathologically. Now we are severing the tissue of concern with the surrounding margins with the help of a periosteal elevator. We are severing it from the bone and the periosteum because we need it in toto, so that we can have enough depth of the tissue and we can analyze it well within the histopathological microscope. As you can see that the tissue has been separated. Also, however, we still require some additional surrounding tissue, which could be granulation tissue, for further analysis. And now, without the need of sutures or stitches, we are cauterizing the area with the help of the diode laser that we have at our practice, and the patient is absolutely comfortable during this procedure. So as you saw in the video, this patient came to us with a palatal ulcer-like lesion, a red lesion, which was very tender, which was the patient was having burning sensation on eating spicy and hot food, and the patient had a chronic history of BD smoking. We found that lesion very suspicious, and that's where we decided to go for a biopsy. Now we took an incisional soft tissue biopsy of the area and we sent it to the lab. Unfortunately, we found it out to be cancer, and now we have referred the patient for the appropriate treatment at a cancer hospital. The whole and sole purpose of this episode is not to create anxiety. A lot of people say if you get the biopsy done, it turns into cancer eventually. That happens seldom, and it's called field changes, but it doesn't happen all the time. But the point of biopsy is not just diagnosis, it's also early diagnosis. The earlier you diagnose the lesion, the better it is. The prognosis of your case becomes better. Your quality of life becomes better. At the same time, the operation extent, the chemotherapy extent, the radiotherapy extent might become lesser, because if you catch the disease such as cancer early, the treatment options can be less invasive, less compromising to the quality of life. And that's the whole purpose of creating this video, to create awareness amongst the patients and the masses about oral cancer. Meanwhile, I keep on reiterating, keep your habits under check. I understand we are living in a very stressful environment with a lot of factors that are epigenetic, environmental, but then again, whatever is in our hands, we need to take care of our health and we need to treat our body like a temple. And that's my last concluding note for this video, that all I'm requesting anyone who is going through this plight of having some sort of an ulcer, a mass in their mouth, and they think that it is suspicious, do not hesitate just because of the fear of the C word. Get the diagnosis done with the help of a biopsy. Go to a good doctor. If they ask for a biopsy, get it done, get the diagnosis, and start with the treatment. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients, and otherwise just drop me a message on WhatsApp and give it 3-4 days so that I can reply to your messages. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.